Hello, I'm Hannah Feinstein, and my service learning project was done on Wednesday, October 11th from 8 to 3 at Pine Haven Elementary School and Bauxite High School in Bauxite, which is in Saline County. We were giving flu shots for grades kindergarten through seniors, including staff. The health department actually was the one who supplied all of the vaccines and sent a couple nurses as well who helped with the vaccines. And the students had their parents sign release forms to be able to participate. The population served is below average income compared to the rest of Saline County. I was responsible for ensuring that each student had their release form completed and signed by a parent or a guardian, and then I was able to give them their flu shot. I would write down the lot number, make it all official, and then while doing that, I'm also responsible for distracting the child so that they're not screaming and crying and trying to pull away from me so that I didn't get accidentally needle stuck. And it actually went pretty well. I was pretty surprised. I only had one child where I had to physically hold them down with someone else to help. As long as their parents signed the form, they were not allowed to refuse, unfortunately for them. This flu clinic falls under healthcare access and quality. And the social determinant of health is the need to increase the proportion of adolescents who had a preventative health care visit in the past year. Right now, that determinant is in decline. Their goal is to have 82.6% of students, children, who are not being seen for preventable illnesses, and we're at 69.6%. Other options for this are the Christian Community Care Clinic in Benton. They offer free services to Saline County residents if they meet a certain poverty level and don't have insurance. There's a few factors on their website. Another community resource is the Arkansas Immunization Action Coalition. It's a nonprofit whose intention is to increase Arkansas residents' vaccination status, which is very necessary. Currently, I work at Children's Hospital in the emergency department. I feel that was a very helpful addition for this flu clinic because I know how to do proper children holds with the bear hug or placing a leg over their lap to make sure they stay down, to keep them still so that they don't jerk and cause us to stick ourselves. It was also helpful because I was able to keep them calm and distracted while giving the vaccine. I was able to distract other students, children's that were getting vaccinations, or my own. We gave over 400 vaccines, and we only had about 5 kids that were actually full on crying. And a lot of times it would be one child that started crying and it set off the others that might have been fine. And pretty much every single one of them, once we finished, we're like, that's it. So it was definitely the buildup. Growing up, I never had a flu clinic at my school. I do remember pharmacies and grocery stores advertising free flu shots. My mom was never willing to get a flu shot for herself because she hates needles, and so she did not force us to get them. But I do know that when I was growing up, I refused any sort of blood draw or shot unless my mom was with me. And I was actually really surprised how many kids ages like 5 to 10 were there getting a shot without their parent. And there were a few times that they were crying for mom or dad, and unfortunately, like I said, they couldn't refuse, so we had to do it to them anyway. But I also thought that's probably why mom and dad aren't here instead to do this. They don't have to be a part of it. But overall, they did really well and were very calm. And it was a very successful clinic. 400 shots in so many hours was pretty impressive. We definitely had more with the elementary school kids. There were less with the middle school and high school. But I was still very impressed. Thank you.